Chemotherapy-induced peripheral neuropathy is tingling in your hands and feet, and what we want to see is how that is changing across chemotherapy. And so we want to look at the effects of exercise on physical function in women undergoing chemotherapy who have breast cancer. The exercises we provide each of our patients are very simple resistance band exercises, which they can complete in the comfort of their own home. They also have Fitbit monitoring, so we can track their steps, and they have daily diaries where they can record their progress and we can check up on them. If something's at too high of a speed or pace for them, we work with the patients to find something that's a little more comfortable, but is still relevant for our phase 2 clinical trial. The exercise seems to have an effect on physical function, particularly cardiovascular function. We find that our heart rates, our recovery heart rates after physical activity seems to be lower, which indicates higher cardiovascular function. And we see that in our treatment group of people doing resistance band exercises versus our control group. Chemotherapy-induced peripheral neuropathy is a common side effect of chemotherapy, but there's not necessarily a known cure. And so we're really looking at symptom management. Over the course of the phase 2 clinical trial, we have many weeks where our participants are answering surveys where they can rate their neuropathy and other symptoms like fatigue and pain, and we can see the progression of those over time. When you think about the overall cost of cancer care, it's over $100,000 per person. And so if we can have a method which can improve symptoms, right, and that's easy to implement and cheap to teach, then I believe is overall good for the field of cancer care. At the end of each study participant's time within our trial, we had them answer an exit survey in which they rated their time, and we consistently see a lot of participants would say they'd recommend the trial to other people or they'd be willing to do it again. They have one of their biggest things is that University of Maryland, Baltimore worked really well with them and was very accommodating.